Hi, I'm just going to show you how to use a new Adult Transfer of Care Obstetrics discharge letter. So it starts by selecting the patient that you're interested in and clicking search and discharge, and in this case you're going to create a new letter and select Adult Transfer of Care Discharge Obstetrics. Create the letter. The letter's been configured to make it easy to complete the letter well. There are some drop downs for some common diagnoses and comorbidities, either on the left-hand side or the right-hand side. Please note that if the letter is only partially complete, use this phrase here to indicate to midwives and other staff that the letter should not be completed until it's been reviewed. The follow-up allows you to very easily capture who's going to follow up the patient after birth. So followed by the midwife, for example. If there are very specific follow-up details, then enter the details in the fields to create a sentence. And if there's specific problems like hypertension, preeclampsia or pregnancy-induced hypertension, then select that, and very detailed instructions will come up for various health professionals involved. Discharge destination is new, and it's a requirement of professional standards to include this in any transfer of care letter. Booking weight is there, just click on that and enter the patient's weight. The VTE risk assessment requires two bits of information putting in. You need to put the overall VTE risk in there, and then the number of persisting risks. Based on that score, you can then select one of the pre-populated phrases, and it will prompt you to write the correct prescription. In this example, we've got an overall risk of 3 and a persisting risk of 2, and it's a postnatal lady. This indicates how many weeks of low molecular weight heparin is required. Blood loss during delivery. If there is a delivery, you need to complete each of the 4 numbered phrases here. So the number of mils lost, delivery hemoglobin level, the post-delivery hemoglobin level, and the ferritin level. These can be used to determine whether ferrous sulfate is required post-discharge using the treatment algorithm on the unit. Medication change during admission. This is a standard box and has some pre-populated fields to enter common changes to medicines, and particularly for post and antenatal, we use the pre-populated sentences to make it easy to capture good information. The next 2 fields are for supply of medicines out of hours. The antenatal ward and the birth suite have different medicine stocks, so choose accordingly. The breastfeeding status is self-evident. If the lady is breastfeeding, make sure you select the one which prompts a pharmacist review. If the patient has no drug allergies, select this phrase. If they do have drug allergies, select this phrase and fill in the appropriate fields. Advanced care planning allows for extra detail to be put in there. Whoever wrote the discharge letter, they can enter their details and the registration number in the appropriate field. The postnatal Athena discharge just allows an extra notification to the GP that more information will come through. The final paragraph is filled in by pharmacy to indicate the quality of the information contained in the letter with regards to the medicines. Once you complete every field, print and complete and make available to the pharmacy team.